Hi YouTube, it's Amy. I wanted to do an update. It's been a couple weeks since I did my plastic surgery skin video, and thank you all for your comments, and thank you for no mean comments, guys. I'm 3 weeks out and I'm nervous, excited, stressed. Yeah, I can't believe I'm having this major surgery in 3 weeks. Dr. Kazen has me doing a lot of pre-op testing, and I wanted to talk about that. I didn't expect all this when I went in because a lot of people don't talk about all this when they do their videos, so I thought it might be helpful for anybody out there that's planning on having plastic surgery. Dr. Kazen has you do a lot of pre-op screening, including a chest x-ray, a mammogram, a physical, EKG, and some blood work that has to be done. I think that's it. Yeah, it's like 5 or 6 blood tests that need to be done. Because my insurance is not covering my plastic surgery, my primary care doctor would not do all of the testing. She is going to do, and I have Kaiser if anybody is asking, and I think if I documented and had Kaiser long enough, I possibly could have had just the skin removed, not a full tummy tuck. Maybe. I do know that they do that through their doctors, but I don't want to wait, and I do want a full tummy tuck, and I really trust Dr. Kazen because I've seen his work, and I've talked to other people that have worked with him, so I really trust him. Anyways, back to my doctor with Kaiser will not do the mammogram and x-ray. And I'm in San Diego, and, you know, I wasn't sure where to go, so I Googled a mammogram and x-ray, no insurance. And I came up with going to the, clinic, the local clinic. And I called them and I said, I need a mammogram and x-ray. What should I do? And they said, well, you could come in and make an appointment. It'd be $150. Then they will refer you to have the mammogram and x-ray done, and you will pay for that, and then you'll have to come back and see the results and pay for that. So I'm thinking, oh my God, this is going to cost me like $500. But I did some more research, and I found a company that you can go in and pay yourself and have it done. And it was really nice. The facility was nice. The mammogram is a little strange. I am only 32, so I've never had to have one done. But it only cost me $225. And I'm thinking in my head, that price is not too bad to be extra safe and make sure that, there's nothing wrong with me before going into surgery. So I had those exams sent to my primary care doctor. Not sure if she's going to look at them or not, and Dr. Kazen. So that is done. I go in for my EKG and labs on the 18th. They have to be done within 14 days of the surgery, and the 18th is 14 days from my surgery. After that, I will wait a few days and have my doctor write me a letter stating that I'm cleared for surgery, so I can send that to Dr. Kazen. Another issue that I'm having with Kaiser is that their prescription program does not pay for prescriptions that are not written by a Kaiser doctor. So I have to take my prescriptions from Dr. Kazen into my doctor and see if she will rewrite them. And she may or may not do that. But I only have a few days to get that done, so I may just have to pay for the prescriptions because I have my my pre-op with Dr. Kazen on Monday the 28th, and my surgery is on Friday, the 4th. And so I have between Tuesday and Friday to either get them rewritten and filled or just going into Walmart and filling them. And I'm sure that that's going to cost me a couple $100 if I have to pay full price. Yeesh. So my quote of this surgery costing me 13 grand is kind of going up a little bit because insurance is not involved. But I feel confident I'm going to get everything done, and I will be ready for surgery. So far, you know, super healthy. I did have labs done last month because I had a physical and everything looked great, so I'm sure that the labs will be the same. There's a lot of sick kids in my area right now. My kids' friends are all sick, so I am staying clear of everybody, and I'm taking 2,000 milligrams of vitamin C a day. I do not want to get any sort of respiratory infection before I go into surgery because that can cause complications like pneumonia. So I'm trying to stay as healthy as possible. I'm obsessed with YouTube. I have been watching a ton of videos of post-op plastic surgery and a little scared. You know, I've seen some different things out there, and I can't stop watching. And I need to de-stress, stop thinking about all the what ifs, and just let it happen. I need to stop losing sleep. I need it to just come and go and be done with so I'm not stressed out no more. Yeah, I mean, I'm just thinking about what are they going to feel like? What if they don't drop? What if they come out uneven? What if I have dog ears? You know, what if it opens up? What if, you know, I have excessive pain? What if I'm allergic to the stitches? You know, so many questions. And there's so much stuff out there that you see ranges from people having to have a second surgery to people bouncing around after 3 days after surgery, happy as can be. So I guess it's good to have, you know, a lot of stuff to watch, but it's bad if you obsess over it. I have experienced an enormous amount of judging, and I'm actually hesitant to tell people about my plastic surgery because I've had the people that I have told have really judged me on this more so than my weight loss surgery. And I think because I do look pretty good in my clothes. I don't know how much you guys can see here, but you know, these are size 6s, stretchy, and they're like totally loose on me. I wear anywhere between a size 2 and a size 6 now. And I was telling somebody at work, because they're curious because I'm going to be off for 4 weeks. Why are you going to be out of work for 4 weeks? So I open my mouth, and probably everybody knows. But this one girl says to me, she goes, "You're already like a size 2-4. What the F? Do you want to be a size 0? And I'm trying to explain to people, I'm not doing this. I'm not having a tummy tuck to be a size smaller. I'm doing this so I can get rid of the excess skin, which you guys have seen. But obviously, I'm not going to fling out my gut everywhere I go and show people what it looks like underneath here. But I do want to show you guys my armor, so I call it, that I wear every day. So I'm going to show you here. I wear a tank top that's, you know, stretchy and holds everything in, and underneath that I wear underwear that goes up to my boobs. And this one's actually too big on me. It's kind of loose, but I wear some pretty tight compression garments every freaking day. And my bra is a Victoria's Secret's Miracle bra that gives me 2 sizes. Yes, these my little bees look like C's in this bra, and I won't go anywhere without it because I look very unproportioned with my little flat B's. So that's my armor, and that's what people see at work. And so when I tell them I'm going in for a breast lift, augmentation, and tummy tuck, they look at me like I'm super vain, and you know, there's no point in that. So I'm having a little bit of a hard time with that. But whatever. I'm doing this for me. I know what I look like underneath here. You guys know what I look like underneath here, and I shouldn't care what everybody thinks, but I do. What else? I just had a new IUD put in, and I don't know if you guys know about the Marana IUD. It's a 5-year birth control that, you know, gets put inside of you. And I had one before, and I guess it ran out, and I could tell that the hormones were running out because I was having stronger periods towards the end. And I had a new one put in. The first day hurt. I was nauseous, and it was the beginning of last week, and I'm actually up 3 pounds since that went in, and I'm hoping that I'm just up. I mean, it's only 3 pounds. I'm hoping that this doesn't cause weight gain, but I'm kind of scared because it is hormones. But I had it in before, so it shouldn't be a huge issue. But I am up 3 pounds. It isn't my official weigh-in day, but I'm 161 today, and if you don't remember, I'm 5'10", so a normal weight for me is 176 pounds, I think. So I'm still well under the normal, but my goal is 159, and I'm 161, so I really want to get back down under my goal. I did see last week 156, so I mean that's 5 pounds from my lowest hit mark, so I'm a little scared. Food's been good. I've been snacking a little more, I think, because I'm stressed out. Still rocking the gym. 120 minutes, 130 minutes, an hour and 20 minutes, an hour and 30 minutes a day, 3 days a week at the gym. I usually do 45 to 60 minutes of elliptical or bike or ski machine. I don't know what those things are called. And then I do my arms. I'll show you guys my arms. Get some muscle there. You know, I don't really have too much hang here. I mean, if I relax them, but I think anybody, if they relax their arms, has a little bit of something. So I'm pretty happy with my arms. So, yeah. I think that's all I got. When I get closer, I'll let you guys know what's going on, but that's where I'm at, and I love you all. Thank you all for the new subscribers, and enjoy my plastic surgery journey, and I'll see you guys all in Vegas. Bye.